Hey everyone, and welcome back to my channel. Today, we're talking about a topic that's super important for your overall health, your kidneys. These bean-shaped organs work tirelessly behind the scenes, filtering your blood, removing waste products, and keeping your body in tip-top shape. But just like any other part of your body, your kidneys can sometimes use a little TLC. We're going to dive into 5 major signs that your kidneys might be sending you an SOS. Early detection is key when it comes to kidney health, so understanding these warning signs could make a world of difference. Let's get to it. Alright, let's talk about the first sign: feeling tired all the time. I'm not talking about the kind of tiredness you feel after a long day, but rather a persistent, dragging fatigue that just doesn't seem to go away, even after a good night's sleep. Now, your kidneys play a vital role in filtering waste products from your blood. When they're not functioning optimally, those toxins can start to build up in your system. And guess what? One of the first signs of that buildup is often overwhelming fatigue. Think of it this way: your body is like a well-oiled machine, and your kidneys are like the filters that keep everything running smoothly. If the filters are clogged, the whole system starts to slow down, leaving you feeling drained and sluggish. So, if you're constantly feeling exhausted, even after getting enough rest, it's crucial to pay attention to your body's signals. It could be your kidneys trying to tell you something's not quite right. Don't brush it off as just being tired. It's always better to err on the side of caution and get checked out by a healthcare professional. Let's move on to the second sign that your kidneys might need some attention: swelling, especially in your legs, feet, or around your eyes. Ever notice how your shoes feel a little snug at the end of the day? While some mild swelling is normal, especially after standing for long periods, sudden or excessive swelling can be a red flag. Here's the connection to your kidneys. Remember how they act as filters for your blood? Well, part of their job is to remove excess fluid and waste from your body. When your kidneys aren't functioning as they should, that fluid can start to build up, leading to swelling, also known as edema. Think of it like this. Imagine your body is like a sponge. A healthy kidney is like squeezing out that sponge regularly, removing excess water. But if the sponge isn't being squeezed properly, it becomes waterlogged and swollen. So if you notice persistent puffiness, particularly in your lower extremities or around your eyes, don't ignore it. It could be a sign that your kidneys aren't able to keep up with their fluid-regulating duties, and it's essential to get it checked out. Let's talk about the next sign: changes in your urination. Now, this one might seem a bit obvious, but trust me, it's crucial. Your pee can actually tell you a lot about what's going on inside your body, especially when it comes to your kidney health. First things first, pay attention to the frequency. Are you suddenly making more trips to the bathroom than usual, especially at night? Or are you finding it difficult to go even when you feel the urge? Both of these changes in urinary frequency can be early indicators of kidney issues. Next, take a look at the appearance of your urine. Does it seem unusually foamy? Is there any blood present? These are also red flags that shouldn't be ignored. Blood in the urine, whether it's visible or microscopic, can be a sign of a kidney infection, kidney stones, or other kidney-related problems. And finally, pay attention to the volume of urine you're producing. A significant decrease in urine output can be a sign that your kidneys aren't filtering waste products effectively. Remember, your urine is like a window into the health of your kidneys. Any noticeable changes in your urination habits should warrant a conversation with your doctor. Now, this next sign might seem a little surprising at first: shortness of breath. You might be thinking, wait, isn't that a lung thing? And you're right, it often is. But here's the connection to your kidneys. When your kidneys aren't functioning properly, it can lead to a buildup of fluid in your body, including in your lungs. Imagine this. Your lungs are like delicate balloons, and when they're filled with excess fluid, it becomes harder for them to expand fully, making it difficult to take deep breaths. This can leave you feeling short of breath, even after minimal physical activity. So if you find yourself struggling to catch your breath, especially if it's accompanied by other symptoms we've discussed, like fatigue or swelling, it's essential to seek medical attention promptly. Don't dismiss it as simply being out of shape. It could be your body's way of signaling a more serious underlying issue with your kidneys. Let's talk about the last sign: persistent back pain. Now, I know what you're thinking. Back pain is incredibly common, and it's not always a sign of something serious. But when it comes to your kidneys, it's crucial to pay attention to the location and nature of the pain. Kidney pain typically presents as a dull, aching sensation in your lower back or sides just below your ribs. It's often described as a deep, throbbing pain that can be constant or come and go in waves. This type of pain occurs because your kidneys are located on either side of your spine, towards the back of your abdominal cavity. When they're inflamed, infected, or obstructed, it can cause pain that radiates to your back. So how can you tell if your back pain is related to your kidneys? Well, here are a few things to look out for. First, the location. Kidney pain is typically felt in the flanks, which is the area on either side of your spine between your ribs and your hips. Second, the nature of the pain. Kidney pain is often described as a deep, aching sensation that can be quite intense. And finally, any accompanying symptoms. If your back pain is accompanied by other symptoms like fever, chills, nausea, vomiting, or changes in your urination, it's essential to seek medical attention immediately. That's it for today's video on the 5 major signs your kidneys need treatment. Remember, your kidneys are amazing organs that work tirelessly to keep you healthy. By being mindful of these signs and seeking medical attention if you experience any of them, you're taking a proactive step towards protecting your kidney health. If you're experiencing any of these symptoms, it's important to consult with a healthcare professional as soon as possible. Early treatment can prevent further complications and help preserve kidney function. Remember, your kidneys play a huge role in keeping your body healthy, so give them the care they deserve. Thanks for watching and stay healthy. For more health tips and updates, don't forget to like, comment, and subscribe.